three members, led by Catherine Victoria, include George Papukis, Lydia Kengwa, Marshall Wild, and Stephen Sheets. We collaborated to prepare this presentation on the Centers for Disease Control and Prevention, a federal agency under the Department of Health and Human Services. The CDC's mission is to protect the health of Americans by providing expertise, information, and tools that people need to prevent diseases, promote health, and prepare for any impending health threats. This is in keeping with its vision of health protection and health equity for all. To accomplish its mission, CDC works with national and world partners, working 24/7 to protect the American people from health, safety, and security risk, confronts global diseases through advanced computing, lab analysis and research, tracks diseases and finds ways to improve lives, provides health information and new knowledge to save lives, reduce waste, and build awareness, fights diseases before they reach United States borders, and as the nation's public health agency implements measures to become more efficient by working with states and local health departments to improve global health. A brief history of CDC. CDC descends from the wartime agency Malaria Control in War Areas was founded as a public health organization in 1946 in Atlanta, Georgia, primarily to fight the spread of malaria. Its initial budget was only $10 million and started with less than 400 employees. The agency paid $10 to Emory University for 15 acres of land on Clifton Road, which now serves as its headquarters. CDC has since extended its responsibilities to other communicable diseases and today is the nation's premier health promoter in prevention and preparedness. CDC's roles in Health and Human Services is to administer Health and Human Services mission and vision, which is to enhance and protect the health and well-being of Americans. As such, the CDC is responsible for protecting the health of the nation, is responsible for public health emergencies, provides leadership and direction in prevention and control of diseases and other preventable conditions, leads national health security, monitors health and informs decision makers, trains and guides, and local public health partners. CDC sources of funding comes from direct appropriations and congressional appropriations transferred from the United States government agencies. It provides two types of funding: acquisitions for direct benefit or the use of federal government assistance, which are grants and cooperative agreements for support of public health. Some examples are: in 2013, CDC was allocated $1.73 billion for direct appropriation for global health programs. In fiscal year 2015, CDC received $1.711 billion in appropriations for Ebola response and preparedness. In fiscal year 2015, CDC received $30 million anomaly continuing resolution and emergency supplement budget for Ebola-related funding. As of 2013, the agency has 10,000 employees and approximately 4,000 contractual workers performing field work in 50 states and over 50 foreign countries. It employs 170 different occupations. In comparison to its parent agency, the HHS has 84,000 employees working with both the United States and in foreign countries. CDC's strategy is to collaborate with its partners, including the World Health Organization, the World Bank, United Nations, Children Fund, the United States Agency for International Development, for sharing employees, intelligence, and resources with them. Here's a look at the CDC organizational chart. Competencies necessary for CDC. Fragmented authority and responsibility puts a premium on systems thinking and effective communication. Team building across professional disciplines. Greater in-depth subject knowledge than state, tribal, and territorial leaders. Narrower scope of knowledge. Experience in managing large organizations. Effectiveness in working with geographically separated teams. Role of CDC in public health. Detecting and responsible to new and emerging health threats, tackling the biggest health problems causing death and disability for Americans, putting science and advanced technology into action to prevent diseases, promoting healthy and safe behaviors, communities, and environment. Scope of the CDC, the global leader in public health, protect and improve health globally through science, policy, partnerships, and evidence-based public health action, protecting Americans from health, safety, and security threats, both foreign and the United States, nation's premier health promotion, prevention, and preparedness. CDC's impact on the public health. CDC works continuous with state and local public health departments, providing them with the guidance and support they need to handle a variety of health threats. Countries are better able to find and stop health threats, and Americans are safer because diseases and pandemics are stopped before they reach the United States borders. American lives are protected by groundbreaking advances in the nation's health. Laboratories, population CDC, impacted by CDC. CD impacts the lives of all Americans, protecting Americans from health and safety threats, increasing the health security of the nation. CDC's work creates programs that improve health and reduce a negative impact on economic consequences. Services provided by the CDC. CDC conducts critical science research, provides health information that protects the nation from dangerous health issues, responds when health threats against the nation arise, protecting the population from diseases and other health problems associated with natural disasters, bioterrorism, and attacks. The CDC has been very successful in achieving its goal of improving the health of its target population, American communities, and citizens. One major achievement includes activating the Emergency Operations Center for National and Global Issues. They have been successful in effectively responding to natural disasters and outbreaks in Ebola, polio, and meningitis. They have also been successful in controlling infectious diseases through vaccines and immunizations through the nation's National Center for Immunization and Respiratory Diseases. Some examples of vaccines and immunizations they have assisted in controlling include H1N1 flu, tuberculosis, anthrax, measles, rabies, smallpox. Lastly, the CDC has been successful in tracking and monitoring disease threats throughout various global locations to ensure that they can be controlled. The success of the CDC can also be seen recently through the launch of several recent programs. In 2012, they launched the Tips from Former Smokes campaign, which has increased awareness of the dangers involved in tobacco usage. In 2006, they established the Global Disease Detection Program, which improves the ability of other countries to detect and control diseases. Lastly, in 2001, they launched the National Center on Birth Defects and Developmental Disabilities Program to expand the research and services surrounding childhood health issues and increase the monitoring of autism. Other notable achievements of the CDC include improvements in lab safety, increased workplace safety, combating antibiotic resistance, and partnerships with local and state health departments. Current goals of the CDC include to react to new diseases. Preparation at all levels of government, state, local, and federal levels have to be prepared. Prepare for biological attacks, funding for vaccines for rare diseases, antibiotic use leading to resistance, preventing future disease outbreaks, safe producing and harvesting of food, safe processing of food, safe distribution and preparing of foods, address public health concerns, ongoing battle against obesity, addictions to prescription health medications, and assist with international issues to include famine, warfare, and water availability. Here's a look at how our portion size has increased, which CDC and other agencies believe is directly related to or directly linked to obesity. CDC is very important to public health, putting science and technology into action to prevent diseases. CDC helps apply scientific knowledge to public health challenges by advising health providers and public health entities. Without CDC, these institutions would have disjointed research and development, promoting healthy and safe behaviors, communities, and environment. CDC provides effective communication about healthy behaviors, allowing institutions, people, and communities to take ownership of their health. Without the CDC, we would lack an essential bridge between scientific knowledge and public health practice, developing leaders and training the public health workforce, including disease detectives. CDC counters the disjointed nature of the public health workforce by providing centralized training and leadership development programs. Without the CDC, leadership and training would lack a national perspective and may not appropriately anticipate and address public health needs. Taking the CDC pulse of our nation, the CDC coordinates public health monitoring functions. Without the CDC, public health data would not be gathered and analyzed effectively. An example of CDC's role and importance: Spanish flu epidemic of 1918 is a good example of a pre-CDC pandemic. Worldwide death tolls of 20 to 40 million. U.S. death tolls are about 700,000. Mortality rate 25 times previous influenza outbreaks. Greater death toll in 1 year than the 4-year death total from the bubonic plague of 1347 to 1351. The Committee of the American Public Health Association issued reports with ideas on prevention, mostly including avoiding enclosed crowds. Response efforts were ad hoc and largely uncoordinated. Another example of CDC's role and importance: Ebola outbreak of 2014 shows the CDC in action. CDC completed 2,000 deployments in the affected countries and 900 deployments in the United States. Over 11,000 people died worldwide, but only one in the United States. CDC trained over 24,000 health workers on West Africa. Thank you for your time. Here's a list of our references.